Chinese natural cures. Traditional methods for remedy and prevention. Includes a complete classification of 100 Chinese herbs and their uses, as well as dozens of herbal formulas, by Henry C. Liu. About the author. Henry C. Liu received his PhD degree from the University of Alberta at Edmonton, Canada. He taught at the University of Alberta and the University of Calgary between 1968 and 1971, and has practiced Chinese medicine since 1972. Dr. Liu now teaches Chinese medicine by correspondence. His students live in many countries, including the United States, England, Australia, Sweden, Italy, Germany, France, New Zealand, Switzerland, Mexico, and Japan. The author is best known for his translation of Yellow Emperor's Classic of Internal Medicine from Chinese into English. This translation of Dr. Liu Sei's other books are recommended by the Board of Acupuncture Examiners in the United States and used widely in preparation for acupuncture licensing examinations. Dr. Liu lectures extensively in the United States and maintains close contacts with the developments of Chinese medicine in China, Japan, Taiwan, and Hong Kong. He has taken groups of Western doctors to study Chinese medicine in China and Taiwan and has helped many distinguished Western physicians establish themselves as outstanding practitioners of herbalism, acupuncture, and manipulative therapy. In March 1982, while leading a group of Western acupuncturists, Dr. Liu was honored for his knowledge of Chinese medical philosophy by Professor Zhao at the Canton College of Traditional Chinese Medicine. He has received many awards from acupuncture organizations in the United States and Europe. Dr. Liu is a patron of Brisbane College of Traditional Acupuncture and Oriental Medicine in Queensland, Australia, an honorary professor of the Academy of Science for Traditional Chinese Medicine in Victoria, British Columbia, and an honorary member of the Acupuncture Association of British Columbia. Dr. Liu lives in British Columbia with his wife, Janet, their son, Albert, and daughter, Magnus. Correspondence with Dr. Liu should be addressed to International College of Traditional Chinese Medicine of Vancouver, Suite 201, 1508, West Broadway, Vancouver, BC, Canada, V6J1W8. The website for the International College can be found at http://www.tcmcollege.com. Section 1. Philosophy and Methods. The system of traditional Chinese medicine. Although traditional Chinese medicine is as old as Chinese history itself, if it is new to you, you will likely have many questions about this type of medicine and what it can offer for your good health. This brief overview of its philosophy and components will help you understand it quickly. Traditional Chinese medicine includes 4 distinct methods of treatment: herbology, acupuncture, manipulative therapy, and food cures. In addition, it encompasses the remedial exercises Qigong, Tai Chi. Traditional Chinese medicine goes back over 3,000 years. It was not developed by any particular individual. Rather, it grew out of the necessity of maintaining good health among the Chinese people. The ancient Chinese, like all of us, had to struggle against diseases in order to stay in good health. In the process, they came to see the benefits of consuming herbs, known as Chinese herbology today, inserting needles in the body, known as Chinese acupuncture today, eating the right foods, known as Chinese food cures today, massaging the body, known as Chinese manipulative therapy today, and exercising the body, known as Qi, Gong, and Tai Chi. Today, traditional Chinese medicine is practiced in China side by side with modern Western medicine. There are as many hospitals of traditional Chinese medicine as modern hospitals of Western medicine. From the Chinese point of view, traditional Chinese medicine is on an equal footing with Western medicine. In fact, many Chinese value traditional Chinese medicine over Western medicine. You may ask why we need traditional Chinese medicine when modern scientific medicine is available to all of us. The reason is that many diseases and ailments that cannot be cured by Western medicine can be treated by traditional Chinese medicine successfully. It is a fact that many patients experience instant relief of pain when treated with Chinese acupuncture, which cannot be achieved by Western medicine. In addition, traditional Chinese medicine has proven superior to Western medicine in the treatment of skin, liver, and kidney diseases, as well as many other diseases. When you go to see a doctor of traditional Chinese medicine, the doctor will observe your complexion and look at your tongue, take your pulse, and ask you many questions about your symptoms, your eating habits, and your food preferences. Then the doctor will come up with a diagnosis of what is wrong with your body and tell you whether you need acupuncture or herbs and what foods are good for you. In China, virtually all kinds of disorders are treated by traditional Chinese medicine. Some disorders may be more effectively treated by acupuncture, others by herbs. Still, others may be best treated by food cures. In general, pain and muscular symptoms are more effectively treated by acupuncture, skin diseases, and disease of internal organs by herbs. However, it is necessary for a doctor of traditional Chinese medicine to make a diagnosis before deciding what type of treatment would be most effective for a particular patient. When a Western doctor tells a patient that there is no cure for a certain disease, it does not necessarily mean that the disease in question cannot be cured by treatments in traditional Chinese medicine either. It only means that there is no cure for the disease by methods of Western medicine. There are a number of basic differences between the two distinct types of medicine. First of all, Western medicine focuses more on the treatment of symptoms, whereas traditional Chinese medicine focuses more on causes. Western medicine is more useful for first aid and surgery, while traditional Chinese medicine is more useful in treating skin and internal diseases and chronic cases in particular. Many remedies in Western medicine are based upon the results of experiments with animals which may not be effective with the human body, but remedies in traditional Chinese medicine are based upon successful experiences in clinical practice which are more reliable. Most Western chemical drugs are strong and tend to produce serious side effects. On the other hand, Chinese herbs, acupuncture, and food cures are less drastic, can be longer lasting in effects, and when used the right way, generally do not produce side effects. Although traditional Chinese medicine and Western medicine operate very differently, it is wise to consult a Western medical doctor in order to get a diagnosis, which may be of some use to a doctor of traditional Chinese medicine, and to get the best possible medical care available in modern society. Traditional Chinese medicine is based first and foremost on a classic published in the 3rd century BC entitled Nijing, or the Yellow Emperor's Classics of Internal Medicine. Western medical books often become obsolete in the course of time, most likely within a few years, but many books on traditional Chinese medicine written by Chinese physicians in the past have become timeless classics. The following passage from the above-mentioned celebrated classic may shed some light on the nature of Chinese medicine. The disease of the 5 viscera may be compared to a sharp needle in the skin, a stained chair, a knot, or a deposit of mud and sand in a river. One could still remove a needle from the skin no matter how long ago it was used to prick the body. One could still wash off a stain no matter how long it has been on the chair. One can still untie a knot no matter how long ago it was tied. One can still remove a deposit of mud and sand in a river no matter how long it has been there. Some people assume that a disease cannot be cured simply because it has a long history, but the truth of the matter is that an outstanding physician can cure disease for the same reason that one can pull a needle from the skin, wash off a stain from the chair, untie a knot, or clear the blockage from a river. A chronic disease with a very long history can still be cured, and those who think otherwise have not really mastered the art of acupuncture. It is a fact that many patients experience instant relief of pain when treated with Chinese acupuncture, which cannot be achieved by Western medicine. Philosophy: Yin and Yang. Yin and Yang are the two most fundamental concepts in Chinese medical philosophy. Rooted in ancient Chinese philosophy, these two opposing concepts are used to account for changes in the universe in a comprehensive manner. In anatomy, the human body is divided into yin and yang as follows. The internal region is yin, while the external region is yang. The 5 viscera are yin, while the 6 balls are yang. And the tendons and bones are yin, while the skin is yang. In physiology, yin stands for storage of energy, while yang stands for human activities. Because yin stays within like a traditional housewife, while yang stays in the superficial region to guard against foreign invasion. In pathology, yin and yang are used to describe the two basic patterns of change. When yin wins a victory, yang will be diseased. When yang wins a victory, yin will be diseased. When yang wins a victory, there will be fever. When yin wins a victory, there will be chill. When yang is in deficiency, it will cause chill sensations in the superficial region. When yin is in deficiency, there will be internal heat. In diagnosis, yin and yang symptoms are used to describe the nature of a disease. According to the Yellow Emperor's classics of internal medicine, a good physician who has mastered the technique of diagnosis will examine the patient's color and take his pulse, and he will classify all symptoms into yin and yang as a first step in making a diagnosis. In terms of treatment, striking a balance between yin and yang is the most fundamental principle of clinical practice. Among the treatments based on this principle are sedating the excess and toning up the deficiency. The Yellow Emperor's classics of internal medicine states a hot disease should be treated by cold herbs. A cold disease should be treated by hot herbs. Yin should be treated in a yang disease. Yang should be treated in a yin disease.